We have not seen any cases. And of course, the ministry is continuing to monitor this. We receive information and notifications from the IHR, which is the International Health Regulations under WHO. And it is still very, very rare. And we are at extremely low risk in Bermuda with respect to patients developing it. It is symptoms are similar to the flu with a rash. So that makes it very easy for clinical diagnosis to happen by observations. We at the Ministry of Health are working with BHB to help to develop guidance for primary care providers, and as well with respect to MDL on sample handling in the event that there are samples that need to be received. And we will continue to work with CARFA to send any samples overseas if necessary. But it is, again, I'm not saying it's not an alarming. Obviously, when we hear about these things, it does create a sense of uncomfortability. The countries in which it seems to be an endemic are in Africa, and it doesn't appear at this point in early days that it's being transmitted via travel. You would probably note from WHO, they have indicated that though it's not exclusive, the majority of the individuals that are impacted are men having sexual relations with other men, close, intimate contact. But again, Bermuda at this point is at very, very low risk, and we are continuing to watch it from our side.
Would you happen to know, I've heard that the US in particular has stockpiled smallpox vaccinations, and I believe anybody prior to 1970 had been vaccinated for smallpox, which is showing some immunity against the monkeypox. Do you know, is the ministry looking into getting smallpox vaccinations in the event it's needed?
I don't have that information, I'm afraid. Again, I have a case meeting at 2:00. So a lot of these things will be discussed at 2:00 with the CMO and the health team.